Hello, my name is Karena Jackson, and this is my presentation on the successes and challenges of integrating community-based patient navigators into perinatal care for Black women. As we get into the history of the idea of patient navigation, it's important to note that the idea of this model came about thanks to Dr. Harold Freeman in the 1990s. He recognized that while medical advances were being made, too many patients, especially those from marginalized backgrounds, were not benefiting from them. His work began in cancer care, but it has since expanded into maternal health and many other areas. Dr. Freeman identified a critical disconnection. We had the science and technology, but delivery wasn't reaching everyone equitably. This gap between discovery and delivery highlighted the need for a new approach, one that helped patients actually access and benefit from available care. As for disparities in care, we know that social and economic factors, low income, systemic injustice, and cultural barriers shape health outcomes just as much as medical care. Without addressing these barriers, disparities persist despite advances in medicine. Patient navigation was created to eliminate these barriers. Navigators act as guides, helping patients overcome challenges like transportation, financial strain, or navigating a complex healthcare system. This approach has proven especially powerful in maternal health, where disparities remain stark and navigation can be a lifeline for families. Perinatal Patient Navigators, or PPNs, at Morehouse School of Medicine, Center for Maternal Health Equity, coordinate care through a comprehensive approach: assessment, connection to resources, education, empowerment, and improved health outcomes. What makes this model unique is that it was not developed in isolation. It was built by, with, and for Black women and birthing people, drawing on our formative research, particularly the Maternal Near Miss Project. In that work, we listened deeply to over 100 women who nearly died from pregnancy-related complications, each interview lasting 2 to 3 hours. Their voices made it clear what was missing in the system and what was needed to survive and thrive. We took those insights and amplified them through navigator training, ensuring that the support provided reflects what Black women said they wanted: practical resources, advocacy, respectful care, and a trusted partner to walk alongside them. This is why navigation is not just a program, it's a community informed intervention grounded in lived experiences. The 3 month intensive PPN training program is designed to provide comprehensive instruction to community members with firsthand experiences. It encompasses a rigorous curriculum covering various essential aspects, including blood pressure monitoring, identification of maternal mental health disorders, evaluation of social determinants of health, and adherence to HIPAA guidelines. Additionally, all perinatal patient navigators participate in shadowing opportunities alongside a diverse array of perinatal professionals. When moms are paired with a certified PPN, they take part in 8 encounters, 3 of which will take place during the prenatal phase and 5 additional encounters that take place during postpartum. These encounters cover several different topics, including information on how to properly communicate with your healthcare team, birth spacing, comfort measures, mental and physical well-being, signs of labor, and postpartum prep. Furthermore, throughout the program, PPNs take part in weekly huddles to troubleshoot patient needs and receive continued education. Navigation in action. So here we'll talk about success stories. I was able to help the mom draft a letter to advocate for a healthier formula option for her child. The current formula was making the child sick, and despite her having a prescription for a ready-made formula, her local WIC office refused to supply the formula. We decided to send letters to every email we could find. Ultimately, this resulted in her WIC getting updated to a healthier option for her baby. My colleague, Danielle, was able to support a mom through her birth and postpartum. Unfortunately, her baby passed away. Danielle was able to garner financial support from the CMHE team, as well as work with the funeral home to cover the majority of expenses and significantly ease the financial burden for the mother. The families we serve face obstacles rooted not in motherhood, but in the systems meant to support them. We perinatal patient navigators help bridge these gaps by advocating for moms, ensuring access to essential services, providing health education, and strengthening communication with providers. We navigators are not just connectors, we are lifelines. We help transform maternal care from fragmented encounters into holistic, equitable journeys towards safe and thriving motherhood. Thank you for listening to this presentation. To learn more about the work of perinatal patient navigators at Morehouse School of Medicine's Center for Maternal Health Equity, you can visit our website on the slide presented.